Yes, keep your eyes open for any of these complications. Yes, see your doctor as soon as possible if you have any concerns about them. And yes, they are treatable.
Hi, and we're happy to welcome Dr. Barry Lewis, and he is a cardiologist at Henry Ford Hospital. And Dr. Lewis is part of our COVID recovery program, and he is interested in cardiological complications after COVID-19. So welcome, Dr. Lewis, and thanks for joining us today.
Thank you, Dr. Danoun. I appreciate the opportunity.
You're welcome. So let's start today. What are the cardiological complications or complications on the heart that you can see after COVID-19?
Well, probably the most common complications that we see today are a cardiomyopathy, which is an infection, if you will, of the heart muscle where it becomes weaker. There's also the incidence of pericarditis, which is an inflammation of the sac surrounding the heart. There have been some issues with heart rhythm abnormalities, but those are probably the major ones that we've seen, really the most common ones that I have personally seen.
And what is the percentage of those complications, if you may, like how often are you seeing those in your clinic and practice?
Not as often as I think the misinformation out there would lead you to believe. It's rather uncommon, first of all. Second of all, the vast majority of people that have these complications do improve over time. The variable, the unknown, is how long it will take to get better. And there's no way to really predict with certainty who will or who will not. We have some markers that would suggest that things will get better over time.
Excellent. So if a patient has issues with their heart and they're coming into your clinic, what are the testing and evaluations that you would do to evaluate the post-COVID cardiac complications?
Sure. Well, it's just like anything else, Dr. Danoun. It's a good history, a good physical examination. The history, what we look for is issues with shortness of breath, swelling of the legs and the ankles, things that are compatible with heart failure, where the heart muscle weakens for whatever the reason may be. In this case, it would be from COVID. Chest pain, if there's the buildup of fluid around the heart, also shortness of breath and swelling in the legs, things like that. Obviously, the first question that you would ask is, did you have an episode of COVID-19 which would have led to something like this? This is what we're looking for if it is a complication of COVID-19. And then once we have the history and the physical examination, what do we look for in the physical? The physical is there any evidence of fluid in the lungs? Is there swelling in the legs, the ankles, symptoms of waking up at night, short of breath, things like that? And then we can go look towards the testing. Probably the simplest, lowest risk test that we can do is an ultrasound of the heart, which is called an echocardiogram, which gives us a tremendous amount of information with the ultrasound, which really, quite frankly, is nothing more than a picture of the heart, which we can get. And then we can also measure blood flow through the heart. We can see if there's any excess fluid around the heart. That generally will give us most, if not all, the information that we need to proceed from there.
And how about having an EKG and other like long-term cardiac monitoring for rhythm and issues?
That's a good point. An EKG, of course, would be the very first step, but an EKG in and of itself is not as specific as the echocardiogram. A chest X-ray would be very helpful, especially if you suspect heart failure, which could be a result of the myocarditis that the COVID-19 could cause. That'll help give us a lot of information. As far as any rhythm abnormalities, any irregularities of the heartbeat, and again, it would depend on what we're finding. A longer-term monitor, such as a Holter monitor, anywhere from 1 day to up to a month, actually, we can utilize a tool like that.
That's very good. And if you identify those changes in the heart structure or inflammation or rhythm abnormalities, what are the available treatment for those patients that they can undergo?
Okay, the treatments really are the same that we would use for any other etiology or cause for heart failure. So the first thing, if there is volume overload or fluid in the lungs, swelling in the legs, a diuretic, a water pill, which would definitely help the patient to get rid of that extra fluid. Other medications such as the family of what are called ACE inhibitors or angiotensin receptor blockers, which help to lower blood pressure, which decreases the amount of work that the heart has to do, would be added as well. And then there are other classes of drugs such as the beta blockers, which help the heart to work more efficiently, things like that. And hopefully over a period of time, things should improve.
So I see here that all of it is kind of reassuring that the rates of the cardiac complications are not very high after COVID-19. And if they happen, they are treatable. And most of them, they can get better with time.
Yes, that is absolutely correct. I think when you look at the number of people that have had a diagnosed infection, the numbers are really rather small.
Mm-hmm.
What we all have to remember is that our knowledge base of COVID-19 continues to evolve and continues to improve, and things may change in the future. But what I want everybody to walk away with is, yes, keep your eyes open for any of these complications. Yes, see your doctor as soon as possible if you have any concerns about them. And yes, they are treatable.
Those are all good news. And how about the vaccine after having COVID-19 and cardiological complications?
I personally have not seen anybody that's been vaccinated that has had any of these complications. The vast majority of what I've seen, actually all of what I've seen, occurred before the vaccinations were available or in the early days before everybody became vaccinated. So I think, at least from what I have read in the updates that I've gotten, if you have been vaccinated and you should get a breakthrough infection, it's definitely milder, much less severe, and you have a much, much lower chance of being hospitalized or worse if you've been vaccinated. So to kind of echo what everybody is saying, get the vaccine.
Well, those are like really excellent recommendations and point that the vaccine will prevent people from having severe disease. And can you touch on the pericarditis complication after some of the mRNA vaccines?
Oh, that has been primarily with the J&J vaccine. It is very, 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 very infrequent. It presents just like pericarditis, usually with chest pain and sometimes with shortness of breath, and you would treat it the same way with the medications, the non-steroidal agents like ibuprofen and aspirin, and eventually it should improve.
Excellent. So that's kind of reassuring that people should get the vaccine, and the vaccine will help them to avoid those cardiological complications.
Absolutely. Yes, sir.
Well, that's great, and thank you so much, Dr. Lewis, for your insight and your expertise in this. And for you, everyone here, we had a whole playlist of all the videos about more long hauler complications, and you can watch those videos for more information. And thank you so much for watching.
Thank you, Dr. Danoun. I appreciate the opportunity.
Thank you, Dr. Lewis.